Hello and welcome to the California Department of Aging's All Stakeholder Quarterly Meeting. Thank you for joining us. Before we get started, I'd like to go over a couple of logistics items and then pass it on to Connie Nakano for a brief overview of the agenda. First, there are several accessibility features available, including ASL, which you should see right above my camera feed, and closed captioning. If you'd like to enable subtitles, please select the icon at the bottom of your screen. The presentation and recording will be archived. To view content from today's or past meetings, please visit the California Department of Aging's YouTube channel. Lastly, please note that all participants will be muted during presentations. If you have questions or comments as we're moving along, please enter them into the Q&A feature located at the bottom of your screen. We're also reserving time towards the end of the meeting for questions and comments, and you can join the queue by using the raise your hand icon again at the bottom of your screen. And with that, I'll pass it over to Connie Nakano.
Thank you, Maria. Good morning, everyone, and thank you for joining today. We have a full agenda today, so we'd like to make sure we get through it quickly and allow as much time for Q&A at the end. So just really quickly through the agenda. The things we've got today to cover, we'll have our welcome message from our director, Kim McCoy-Wade. We'll touch on some COVID-19 updates. We'll hear from Mark Beckley, our Chief Deputy Director, about Aging and Adult Services. We'll also hear from Amanda Lawrence, our MPA Project Director, about the Governor's Master Plan for Aging. And then we'll move through some state spring budget proposals and federal stimulus updates, and also departmental updates from Thomas Cameron, our Deputy Director of Admin Services. And then I'll also update on Older Americans Month. And then we'll move into the Q&A portion of today's meeting. So let's move on to our welcome message. I'd like to welcome Kim McCoy-Wade, our director.
Good morning, all, and thank you, Connie, and welcome as our new communications director. Thank you so much for joining us. This is our second quarterly all stakeholder call of the year, and our fourth completes our first year at trying this. So welcome your feedback on that. Just want to say to welcome, of course, we continue to be laser focused on responding to COVID. But as spring has sprung, we are also turning to the recovery from COVID in every sense, economic, emotional, in every way that we as families and communities and individuals will be recovering. We also are laser focused on remedying the inequities that were painfully exposed in COVID and all around us. And third, rebuilding back better. We know before COVID that we have many opportunities and challenges in aging and disability and family caregiving, and COVID only underlined them more. So with that focus on recovery, remedy, and rebuild, let's get started with our updates for today. I will lead us through a COVID update. As everyone on this call well knows, COVID has had a disproportionate impact on the lives of older adults. If this data slide, which is very dense from our colleagues at CDPH, but I'll call your attention to the light blue bar at 65 plus, you see that actually cases among people 65 plus were lower than the population, largely because older adults stayed home and stayed safe. But if you look to the far right, deaths dramatically exceeded that. And we see that older adults 65 and over make up nearly 75% of the lives lost to COVID. Next slide. That is further amplified by the disparities in race and ethnicity. The cases and deaths that impacted older adults more severely impacted older adults who are Black, Latino, and some of our Pacific Islander communities. And so those racial disparities are just as much as part of the story as the age disparities. Next slide. This means for the aging community, we have a lot of losses and a lot of grief, and we continue at CDA to remember those lives and hold all of us who are grieving, have space for that, because that is part of our recovery as well, as all of those who we've lost and honoring their memory and bringing forward their legacy. Next slide. But as our governor reminded us, spring has brought us a lot of hope, and no better place than in the vaccines. Older adults were the very first to be vaccinated, beginning with the older adults living and people with disabilities in nursing homes and other congregate facilities, beginning in January to the general population of 65 plus, and expanding to people of all ages with high risk medical conditions and disabilities in March, and now this week expanding to the whole state through 16. So the good news is we are making progress in reaching older adults. And of course, the continuing news is we have more to go. So more efforts are coming. We're very excited to be working with our partners so that by the end of the month, there will be new options for transportation and new options for in-home services available statewide, building on what's already available with local public health and health plans. So more is coming by the end of the month. And more outreach is coming, more targeted outreach to folks who have questions, language barriers, other barriers to getting the vaccine. Thanks to some new federal stimulus money, you'll hear about more in a second, targeting older adults and people with disabilities access to vaccines. And then lastly, the other good news, of course, is the stimulus. And we're so grateful that the governor and the legislature squarely included people of older ages and with disabilities in the Golden State stimulus package. Just a fast fact that about 1 million older adults will be able to participate in the crucial Golden State stimulus economic support during this time, including people receiving SSI, low-income older adults and people with disabilities, the older adults who work and file for the state earned income tax credit. We're the only state in the country where older adults can file, and you can't nationally, so please take advantage of that. And of course, we have older adults caring for children in the CalWORKs program. So all prongs of the Golden State stimulus benefit older adults, and we're grateful for that. So I'll hand it off to Mark now to continue the story of how CDA's programs in particular are responding and reopening and planning ahead. Mark.
Thank you so much, Kim. Good morning, everybody. My name is Mark Beckley. I'm the Chief Deputy Director for the department. I'd like to start off by going over some key program updates and data for aging adult services programs. This gives us an opportunity to celebrate all the hard work and tremendous contributions that our local partners and providers are performing in the service of helping our older adults get through the COVID pandemic. As a reminder, all of our program data can be found on our data reports page, which can be reached at the link referenced on this page. The data reports page contains data dashboards for several of our aging and adult services programs, including meals delivered, information about information assistance, Ombudsman crisis line calls received and answered, as well as demographic data for older adults. Next slide. We're also pleased to report that we have additional data now available. We've completed our program fact sheets for fiscal year 19-20. These fact sheets contain a variety of fiscal and service data for programs that includes information about program expenditures by fund source, number of services delivered, number of participants served. Again, you can reach this page by clicking on the link included on this slide. All right, next slide. I'm also happy to report that CDA is in the process of expanding its equity data. We currently collect a variety of aggregated de-identified demographic data about our participants, including participant age, ethnicity, and gender. We're now expanding our equity data to include sexual orientation and gender identification, or SOGI data. We've been collecting this data for our registered programs specifically. Our registered programs are those programs for which we're responsible for providing demographic information to our partners at the Federal Administration of Community Living. And some of the registered programs include programs such as personal care, home delivered meals, case management, and family caregiving services. So on the slide, you'll see a snapshot of the type of SOGI data that we've been collecting. We're going to continue to refine and validate this data, and we should have more data to share. We do note that there are some shortcomings in the data, specifically the fields decline to state and missing. So it's not a perfect data set by any means, but it's definitely data that we didn't have before, and it will help us identify gaps in service delivery and needs of the populations that we serve. Next slide. Okay, I'd now like to go over some data that really celebrates the accomplishments of our local partners and providers. This next slide shows the accomplishments that our local partners have had in bridging the nutrition gap for older adults. So as you can see, we have delivered 10 million meals for the first quarter of this year. That is phenomenal. This puts us on track actually to exceed the total number of meals delivered last year, which was 28 million, a record high for our program. And really just, kudos to all of our local providers for quickly expanding their meal services and reaching more older adults in the state than ever before. All right, next slide. We also have seen a high demand in public information and telephone assistance services. So we have an agreement with the Institute on Aging to provide the Friendship Line, which is an emotional support counseling line for older adults. We clearly have seen a need for emotional support and counseling throughout the COVID pandemic to address issues of loneliness, isolation, depression, anxiety. On average, the Friendship Line is taking 283 calls a day, so serving 283 older adults. And for the first quarter of this year, they have answered 25,000 phone calls. Our local AAAs are also experiencing high call volumes. For this first quarter alone, they've seen 250,000 calls, 252, 778 calls. And so we can clearly see that there's still a high demand and great need for information and assistance as the pandemic continues. All right, I also want to provide an update on our digital device distribution program. So we've talked about bridging the divide or the gaps for nutrition, for information assistance. We're also bridging the divide for digital devices and services. So we have distributed 4,000 or are in the process of distributing 4,000 iPads to our local area agencies on aging. These pads will be provided to older adults who live alone and are low income. And so this will help provide them with social engagement as well as access to information assistance. We've also deployed 8,500 Google Home smart speakers to our local area agencies on aging and our multi-service senior services programs. And this will again help with social engagement, day-to-day tasks, and access to other information that older adults may need. So very happy. That was a generous donation from Google, by the way. So really pleased for the partnership with Google. Okay, so I want to move along as the state, Kim mentioned, continues to successfully vaccinate increasing numbers of Californians. And as the state is gradually moving beyond the blueprint for a safer economy towards reopening, CDA is starting to issue reopening guidance for our partners and providers to provide in-person, in-community, and in-home services. In the fall, we started this by providing guidance to our local ombudsman programs to resume in-person visits. On the next slide, I'll be talking about data associated with those visits. On April 8th, we released guidance to our CVAS providers. At the end of this week, we'll be releasing guidance to our MSSP providers. And then next week, we'll be releasing guidance to our AAA programs. And I just want to take a moment to recognize the innovation, creativity, and hard work of our local providers, MSSP, CVAS, and our AAAs in being creative in the way that they deliver services to make sure that older adults do receive critical health and social services during the course of the pandemic. Okay, next slide. Okay, so this is some data on our long-term care ombudsman program. Last September, our ombudsman programs had started to resume in-person visits. And we've seen really great growth in the number of visits, in-person visits that have been conducted. So between the months of February and March, we're seeing a growth of 1,400 visits. So that's a tremendous increase. However, we still have a long way to go. If you look at the February data, we see that approximately 6,000 visits were conducted. So we have quite a hill to climb from the 2,300 visits that were conducted this past February, but we're definitely headed in the right direction. And again, just a lot of, thanks and, celebration to the ombudsman for getting back into the facilities and ensuring that residents of nursing homes and residential care facilities for the elderly are cared for and are able to report incidents of abuse and neglect. Okay, and then next slide. Finally, I'd just like to provide an update on our Older Americans Act state plan. As we mentioned in our last meeting, California is required to submit an Older Americans Act state plan once every 4 years to our federal administration for community living. Our state plan is required to be submitted to ACL on July 1st, and it goes into effect October 1, 2021. While it's a statutorily required document, it also, and I would say more importantly, serves as CDA's blueprint for California's Older Americans network to build an equitable, age-friendly California through advocacy, partnership, and services. Our plan was intentionally designed to align with our Master Plan for Aging, our CDA strategic plan, as well as our local area plans. Next slide. The plan is now available on the CDA homepage for view. It is a draft plan, so please review it. We have put up a state plan survey. That survey will be available until May 5th, 2021. So please take time to read the plan, see if you find anything missing, anything that you'd like to comment upon. Would love to hear your feedback. And we will continue to revise the plan up until the date that will be submitted to federal ACL. So we really welcome your comments. I also want to note that we have 2 public hearings scheduled. The first one is scheduled on Monday, April 26th from 1 to 2:30, and the second one is scheduled Thursday, April 29th from 9 to 10:30. So if you're able to make those public hearings, I really encourage you to do so. Our director will be speaking as well or chairing the meeting, as well as a lunch meeting from the Commission on Aging. So it's really an opportunity for the public to hear a walk through the plan, as well as to provide their feedback. And that's my presentation. Thank you. And I'll turn it over to Amanda Lawrence, who is our project director for the Master Plan on Aging.
Hi, good morning, everyone. I would like to provide you with a few updates of where we are with the Master Plan for Aging, or as I'll refer to it, the MPA. So the MPA was released this year in January with 5 bold goals and 23 strategies for 2030. We released it just over 4 months ago with a virtual summit with Health and Human Services Secretary Mark Galley, along with several of our key stakeholders and legislative partners who are integral to the development of the MPA. This plan features 5 bold goals: housing for all ages and stages, health reimagined, equity and inclusion, not isolation, caregiving that works, and affording aging. And within each of these goal areas are several strategies to guide implementation. Just a few days after we launched, the governor revealed his January budget for 2021. And it included many investments for aging, including funding to take the Aging and Disability Resource Connection statewide, a comprehensive and coordinated approach to Alzheimer's, expansion of support housing and senior nutrition, increased geriatric workforce, and many, many more areas that are related to the Master Plan for Aging. We have posted this link to a summary of all of those investments on our homepage. The MPA also includes a local playbook. It is meant to guide local governments, community-based organizations, and philanthropy in the implementation of their own master plans for aging. And we have begun trainings and informational sessions with local leaders, such as the California State Association of Counties, regional LTSS collaboratives, local health jurisdictions, as well as building up our relationships with AARP's age-friendly network members in California. Also included in the Master Plan for Aging is our data dashboard for aging. We've recently added indicators and made other updates and enhancements since the MPA launch, and will continue to do so. We already have, or will soon be hosting, more demonstrations and user testing sessions with local leaders and partnering agencies, including the area agencies on aging. One of our upcoming enhancements includes the inclusion of the SOGI, or sexual orientation gender identity data. It will be added to the demographic section of the dashboard. Also integral to implementation of the MPA is our Impact Stakeholder Committee. This committee, which will advise on the MPA implementation, will soon be announced, and it will be comprised of stakeholders representing the myriad of sectors and interests of older adults, so that we can build a California for people of all ages and abilities. And also, you should soon see our first progress report. We will be releasing this in early May, and it will include not just the Department of Aging's activities, but also our partners in the Master Plan for Aging. Next slide. So moving on to some of our initiatives. We recently announced the California Health and Human Services Disability and Aging, Disability and Aging Community Living Advisory Committee. The first meeting will be April 30th. The purpose of this committee is to advance community living, inclusion, and integration across California. So the committee will ensure the involvement of individuals with physical and intellectual disabilities, older adults, and/or other partners who provide services or represent consumers. The committee will advise CHHS and other state entities on community living and policies and programs. We also announced our Equity and Aging Advisory Committee. Their first meeting was March 16th, and we will meet again on June 16th. This committee will advise CDA and the MPA on process and implementation of services and deliverables, ensuring that equity lens is applied to all of these activities. And also, CDA has not been going it alone here. We have our partners have been forging ahead on the MPA initiatives as well. Just a few examples are improving access to food and nutrition services with the Department of Food and Agriculture, increasing broadband access with the Broadband Council and others, promoting livable communities and housing for adults with the Strategic Growth Council, and improving access to LTS, including the launch of the Insurance Commissioner's Long-Term Insurance Task Force. And just last month, California Department of Social Services, they hosted a housing and homelessness learning forum specifically focused on supporting older adults. Now, legislation, of course, is key to moving forward with the Master Plan for Aging's initiatives. And of course, so we have here a link to Justice in Aging summary of the 2021 legislative bills related to the Master Plan for Aging. This can be found on their website. Justice in Aging was a key partner and is a key partner in the Master Plan for Aging, and they fight older adult poverty across the country, and they have a special focus in California. Next slide. And of course, I want to mention that we continue to put on our monthly peer-led Ensuring Equity in Aging webinar series featuring national, state, and local leaders. We host this every first Wednesday from 10 to 11. The one this May 5th is Alzheimer's disease and other dementias, culturally responsive services, support, and care. All of our past webinars have been saved on our Equity and Aging Resource Center. The link is on this slide. And we really hope you can join us. Registration is also accessible on that web page as well. Thank you. I will pass it over to our next speaker. Oh, and here's how you can stay updated. We have a newsletter. Please subscribe. You can find that on our home MPA webpage.
Thank you, Amanda. My name is Thomas Cameron, and I'm the Deputy Director for Administration. Today, I will be going over some updates on the state's spring budget process and how it has impacted the Department of Aging and our efforts and work in implementing the master plan, as well as federal updates on COVID relief funding and some departmental updates. So I'll start with our new state spring budget proposals. Listed on the screen, you'll find 4 different approved spring finance letters, and each one of them we've included the link so you can view the full proposal. So I'm going to go through each of these, but I just wanted to know that that additional detail and information is available to you by just clicking the link once we post these slides. So as you've heard, it's an exciting time for CDA and our aging network as we continue to see investments in services as well as in the implementation of master plan via resources, as well as some MPA initiatives. One of the first investments that I'd like to touch on is our Master Plan for Aging Implementation Finance Letter. As you can see, it provides CDA with 20 full-time positions and $3.26 million in fiscal year 2021-22 and $3.3 million in fiscal year 2022-23 and ongoing. And these are general fund investments. This proposal provides resources for CDA's initial phase of master plan implementation, providing us with necessary policy, technology, data, project management, support, and legal resources. The proposal also includes contract funding and authority for CDA to hire an IT technical consultant to assist with the implementation of our CRM project or our client relationship management project, as well as additional position authority to fund the ongoing work of our fall prevention program manager for another year, which lines up with the governor's budget proposal we had to extend the expenditure period for the fall prevention program. The next proposal is our Aging and Disability Resource Connection proposal, and it's titled Extend and Increase Funding to the Aging and Disability Resource Connections. That provides the department with 13 full-time positions, $1.95 million in fiscal year 21-22, and $1.87 million in fiscal year 22-23 and ongoing. Again, this is another general fund investment. And this proposal provides CDA with our state resources to support the governor's budget proposal that provided additional local funding for the expansion of California's Aging and Disability Resource Connections to help us achieve a no wrong door system. It'll provide the initial resources we need to continue expansion statewide, and it'll also provide program and support staffing needed to maintain oversight, monitoring, compliance, technical assistance, and data collection efforts as we continue to grow this program and try to achieve our no wrong door system. The next spring finance letter is our Health Insurance Counseling and Advocacy, or HICAP, modernization proposal, which provides limited term resources for 2 years, including 3 positions, and $2.06 million in fiscal year 21-22, and $2.04 million in fiscal year 22-23, as well as a proposed budget bill language, allowing the department flexibilities in accessing these funds. And this is an investment of HICAP special funds, not general fund. And so again, this is providing us limited term resources, both at the state and the local level, for the modernization of the HICAP program through various targeted initiatives. Things such as evaluation of ongoing and existing resources, both at the state and federal or state and local level, to identify the appropriate level of resources needed for the HICAP program so we can start to reach more Medicare beneficiaries and align services with our needs and the population resources. One of the other initiatives is leveraging data-driven approaches and implementing new technology across the program to help innovate service delivery and streamline administrative and operational workloads. Additionally, we'll have funding to update training resources, tools, and systems for local HICAP programs and staff, and really focusing when we're doing that on ensuring equity and access. Additionally, we'll be developing a statewide outreach and updated branding, which will help us increase awareness and brand recognition, and updating consumer resources to be more accessible and available in various language. The goal of this proposal, like I mentioned previously, is to leverage these funds over the next 2 years to achieve specific modernization initiatives for the program, and also during that time to collaborate with stakeholders and the administration and the legislature to develop a long-term strategy to expand and improve HICAP services while aligning the resources with available funding. The last spring finance letter that was recently released was our Office of the Long-Term Care Patient Representative proposal. This provides 6 full-time positions and $2.51 million in 21-22 and $3.99 million in 22-23 and ongoing. And this is proposed to be the California Department of Public Health Licensing and Certification Fund. And also this proposal includes various statutory changes and provisional language to provide authority and establish the office. This proposal will provide the department with resources to establish the new office and function of the patient representative within the department and to provide a uniform statewide approach to represent the interests of otherwise unrepresented patients within facilities. The proposal will also provide local resources for the provision of patient representative services via contracts with local providers such as AAAs or other community-based nonprofits beginning in the second half of fiscal year 2021-22. So that's our overview of the spring budget proposals that were recently released on April 1st. So if we could move to the next slide, I will go over some info on our federal COVID response funding. So as we mentioned in our last stakeholder meeting, CDA has distributed $59.7 million in CARES Act effective March 2020 and $23.8 million in Families First Act funding. And this was all funding in response to the COVID pandemic to expand services and respond to local needs for things such as senior nutrition or other local programming that was needed to help those older adults who were now having to stay at home and still needed the appropriate services that our department provides and our local area agencies on aging provided. Next slide, please. And that takes us into our new federal COVID-19 response funding that we're starting to see come in. So we have 3 new categories of federal stimulus funds that were recently approved. The first one was part of the Consolidated Appropriations Act, which was our standard federal budget. It also included an additional federal stimulus. So the Department of Aging is receiving $17.9 million for our total allocation. And that breaks out to $17.5 million that's designated for senior nutrition programs, which includes home delivered meals, and $417,000 for our local long-term care ombudsman program. Additionally, we saw the approval of the American Rescue Plan, and with that comes another significant federal investment for COVID relief funding. CDA is estimated to receive $146.8 million, which breaks out into the following categories: $47.8 million in supportive services, $78.4 million in senior nutrition, $4.6 million in preventative health, $14.9 million in family caregiver, and $1 million for elder abuse prevention. The most recent additional federal stimulus funding is our supplemental vaccine funding. And there are 2 different pots of vaccine funding. One is specific to our area agencies on aging, and they're slated to get $5.2 million. And our Aging and Disability Resource Connection is slated to get $1.6 million. And this is to help the locals in California reach those older adults that have yet to be vaccinated, and to provide, to do that through providing transportation, additional information, outreach, and various other targeted activities to ensure that we are able to reach as many older adults for vaccination as possible. The department plans to start issuing guidance and start distributions in the following manner. So our vaccine supplemental funding, we plan to release our guidance in May, and shortly thereafter, we'll start working towards any funding distributions. The Consolidated Appropriations Act funding, we will plan to release guidance in June. And again, distributions will follow shortly thereafter. And our American Rescue Plan, we estimate we will release guidance in July. And again, funding distributions will follow immediately thereafter. Next slide, please. So here are some department updates on our relocation. that we thought would be of interest. As we have mentioned previously, CDA is scheduled to move into a new location in September 2021. Our new office will be located at 2880 Gateway Oaks Drive, and as you can see, there's a picture of the exterior of the new facility. Our new facility will address access and inclusion issues and will meet or exceed all ADA standards. It'll be climate friendly and energy efficient by achieving LEED Commercial Interior Silver certification. We will be including and interweaving technology and other modern tools throughout the facility to help ensure our staff can do their jobs and do them easily. And we will ensure that we have also additional collaborative spaces, such as conference rooms that are capable of hosting training and convenings with the appropriate size groups that we normally have for the different events that we previously hosted. The department will, apologies. The department will be taking 2 floors in this facility. And just a quick update on construction and demolition. The construction or the demolition has been completed for our 3rd floor. And for the 2nd floor, which will be located, it is slated to be finished next week, and construction and framing will begin. And on the next slide, just wanted to provide some staffing updates. Recently, we've had 2 of our executive team members retire. Irene Walela, who was our Deputy Director for the Division of Home and Community Living, retired, as well as Joe Rodriguez, who was our State Long-Term Care Ombudsman for many, many years. Additionally, we've added 2 new executive team members. Jeremy Avila has come on board as our new Chief Counsel, and Connie Nakano has come on board as our new Assistant Director of Communications. And with that, I will hand it over to Connie.
Great. Thank you, Thomas. So I wanted to cover a little bit about Older Californians, actually Older Americans Month. So every May, Older Americans, we celebrate Older Americans Month. This year, the theme is Strengthen Communities. To commemorate this month, we're excited to be launching California Chronicles. It's an exciting partnership that we have partnering with the California State Libraries and also UC Berkeley. So what California Chronicles is it's a diverse collection of stories that highlight experiences and contributions of older Californians. By sharing these stories and contributions of older adults, it inspires people of all ages, and these legacies will strengthen communities and spark connections between generations. So all these stories won't just be shared, but they will also be archived through the California State Libraries. So now we're in the story collection phase. Stories can be submitted in various forms. So whether it's written, an audio story, a video story, artwork, or a poem, we encourage all different types of forms that folks want to submit their stories. We invite you to all both promote and contribute stories. More information can be found on our website, or a direct link will also be available on this PowerPoint after this meeting. So we're really excited about this project. So we really look forward to partnering with all of you with story collection and also story submittals. Now we'll move on to the question and answer phase. Marie, you want to take it over?
Sure, I'm happy to do that. And thank you, Connie. But we're going to turn to Q&A. I know I've got quite a few questions in the Q&A box that I'm seeing, but if you have comments and questions and you'd like to be unmuted, please feel free to use that raise hand feature. So we'll jump right in. A question about the digital divide. How is the digital divide distribution benefit? How is the digital divide distribution benefit assisting older adults of color from Native American, Latinx, Black, and other communities who live in households with other family members?
Hi, I'd be happy to answer that question. This is Mark Beckley. Let's see if I can start my video. So with the initial distribution of tablets, we did have a limited amount of money, and it was very important during the time of stay-at-home orders to address issues of loneliness and isolation. in order to really effectively reach that population, we did target iPad distributions to those who live alone and who are experiencing incidents of loneliness and isolation. If we have the opportunity for future further digital releases, we definitely do intend to make sure that those distributions are equitable. In fact, the guidance that we've given even for the iPads that were distributed was that they should go to diverse communities and underserved communities. So we are ensuring that equity is being baked into any of our initiatives. But yes, if we do have further opportunities, we will look at deploying these to families, so households with other members in them.
Thank you, Mark.
Mhm.
There was a couple of questions about the re-entry guidance. I'm going to try to just sum those up. So what will the re-entry guidance have? The re-entry guidance scheduled for April 30th, what will it entail? Will it include guidance for resuming in-person services for CBAS or HICAP? And can it be used for those providing care management services who may not be associated with the area agencies on aging? An example is a city senior center.
Right, so thank you for that. And I can answer that question as well. So our reopening guidance for the CBAS centers, the ACL has been published, and there are very specific criteria and timeframes associated with reopening facilities. Now, keep in mind that while we're still under the emergency declaration, our CBAS and MSSP providers will continue to have the flexibilities, such as providing remote services that the federal ACL and CMS have allowed. So yeah, if you have the time, yeah, definitely take a look at the CBAS guidance. The MSSP guidance will be similar. Regarding the AAAs, the AAA guidance is going to be more general in nature. It will talk about general timeframes for reopening. So as we move beyond the blueprint for a safer economy, the governor does have a target date of June 15th to reopen the economy, assuming that there's sufficient vaccinations to vaccinate everybody who's 16 and older, and based on public health guidance at that time. So that will be the opportunity to start reopening centers. But again, we always look to public health information, to federal guidance to guide how and when we reopen facilities. So, I believe that, our AAA directors, for instance, will be having a lot of conversations about best practices and safe ways to reopen their facilities.
Thank you, Mark. And I don't know if this is a question you can answer, if this is really directed to Thomas, but this is about the Ombudsman program. And there was a couple of questions asking for a quick overview of the difference between the long-term care ombudsman and the new long-term care representative.
Yes, no, I'd be happy to answer that question. So I could see how there would be some confusion on these two different functions. So the Office of the Long-Term Care Ombudsman responds to incidents of complaints about neglect and abuse in skilled nursing facilities and residential care facilities for the elderly. So they're constantly in the facilities monitoring and meeting with staff and residents. The new Office of the Patient Representative is different. It is really intended to serve those residents who are incapacitated and unrepresented for the purpose of having health decisions made about their care and their treatment. So each facility currently convenes what's known as interdisciplinary teams, which consist of doctors, social workers, nurses, to talk about care and treatment for residents when they're incapacitated. Under current law, the facilities are required to have what's known as a patient representative on the board that's supposed to represent the wishes of the patient in the event that they don't have a health directive or POLST in place. So that representative will be conducting investigations, looking at anything that the patient might have put down in writing or talking to friends and family members, in order to understand what the wishes of the patients would have been for their care and treatment. The facilities always look to families and friends first to serve as patient representatives, but if those representatives don't exist, then CDA through local providers will be providing a representative to represent those patients.
Thanks, Mark. And I see that Kim might be typing the answer to this one actively into the Q&A, but there was a question about federal funding and if the California Department of Aging can speak to the oversight and accountability mechanisms in place to ensure that incoming funding is distributed in an equitable manner.
Sure, I'd be happy to verbalize what I also put in the answer, which is yes, yes, and yes. There absolutely are expectations and directives in the Older Americans Act to target equity, and we do collect and have posted just recently our annual required fact sheets that have a fair amount of demographic data, not complete by any means, but have that baseline. And now what we're doing, both out of a master plan recommendation and out of our new Older Americans Act state plan, is taking a deeper dive and looking at how our service numbers line up with our population numbers and our need numbers. And not just at our Older Americans Act, but at the new money that you heard about from Thomas, the CARES, the Families First, the American Rescue, the Consolidated Approach, the vaccine, 5 different federal pots. So yes, we have some transparency on baseline, and we're moving towards a deeper analysis this summer and fall about how we're doing on meeting true equity goals and building a California for all ages. And then it's in our state plan over the next 4 years to continually increase and drive that. One particular strategy named in our draft state plan is greater partnerships in an appropriate government way with California's tribal organizations. There are dedicated tribal funding for tribal organizations and explicit and express goals around serving Native American elders that we want to learn more about and do better about in coming years. So those are just a couple examples of the baseline data, a coming report later this year, and then ongoing program improvements suggested in our draft plan.
Thank you, Kim. I do want to recognize that we've got Charlene, who's been patiently waiting with her hand up. And Charlene, I'm going to open your line. You should be able to unmute yourself and jump in with your comment and question.
Yes, in opening, a lot of it is with the 6-foot distancing. Our agency works with seniors, but our people are blind, so many of them need to be guided. Is there any guidelines for working with people and opening agencies that work with people who are, due to their health or disabilities, cannot function with 6-foot distancing?
Thank you for the question. And that's something that we are in dialogue with the Department of Public Health, as well as there's 7 departments that that include services, people with disabilities, and we are all kind of coordinating. And frankly, we welcome input and advice on that so that we remain accessible and inclusive and also tailored to different populations and different people's needs. So it's a work in progress, and welcome feedback here or otherwise on that.
Okay, my email was included in my entering, so you can contact me through my email.
Thank you, Charlene. Thank
you, Charlene. If any other folks want to jump in and have their lines open to ask a comment or question, I see somebody has their hand up. It's an email at myDSLC.org. Your line's been open, so just feel free to unmute and jump in.
Hi, thank you. My name is Madonna. So I work at Disability Services and Legal Center based in Santa Rosa, California. And you just spoke about the tribal entities. I am an enrolled Native American, and I've been with the agency for almost 2 years. And we do serve 4 counties: Sonoma, Mendocino, Lake, and Napa. And I've done extensive outreach before the pandemic, and in Mendocino County, our office there is about 11 miles from one of the local tribes, and that has been open for 20 years, and none of the Native Americans had used our agency. And I would like to help you guys to connect with the local tribes, because I'm related to all of them. And before I started working here, I had not ever heard of an independent living center. So I would really like to help you guys connect with the local tribes, because the Native American population is unserved. They're not being served.
Thank you very much. That's what our data looks like too. So thank you for your firsthand expertise and story. We have calls this week with our federal partners to again have the appropriate government to government engagement, and we have just joined a state coordinating group of serving tribal communities. So we are learning, and we will absolutely take you up on that offer and help with that connection with your local aging.
Yes, I would love to introduce you to the Native American circles. So my email address is madonnafeather@myDSLC.org. And yes, I would love to introduce you to them.
Thank you.
You're welcome. Thank you.
Okay, Tatiana, I see that you have your hand up. Your line's open, so unmute and jump in.
Thank you. Can you hear me?
Yes.
Okay, great. Yes. So I'm also affiliated with California Health Advocates, and with respect to outreach to Native Americans, I want to guide or offer anybody on the call that if they go onto our California Health Advocates website, cahealthadvocates.org, we have a page specifically dedicated to tribal outreach and also information. And we have a MOU with the CIMC, the California Indian Manpower organization, and we do a lot of outreach, of course, pre-pandemic, but we're also participating in the NICOA conference coming up in in August. So if anybody's interested in learning more, the National Indian Council on Aging is a great resource. Thank you.
Thank you, Tatiana. We do have a resource page of connections like that. So among other things you mentioned, we'll make sure that we're digitally linked, but appreciate that connection and amplification of that wonderful resource.
Great, and it looks like we have just about 1 more minute left. So I do want to turn back to the guidance that's being released on April 30th. There are several folks that are asking about whether it will address congregate meal programs. Kim, can you speak to that?
Yeah, I can just, as Mark mentioned, we will be able to provide some general information and some resources of national guidance and other. We have to be very careful. We do not want to dictate to our local programs or not be appropriately deferential to local conditions and local public health orders as well. So I don't want to overpromise what will be in this guidance, but it will be a framework and a template and resources to begin to reopen congregate meals. We have surveyed our AAA providers and see that there's a whole spectrum of folks who've begun to reopen, who are thinking about reopening, who are not yet ready reopening, depending on a host of factors. And we also received a request, a really thoughtful request from our AAAs yesterday to form a work group to kind of work through this time together. So we'll be doing that as well. So I don't want to suggest that everything will be answered in a magic document that comes out next Friday, but it will be the beginning. I think you can look at the CBAS guidance for the kind of level of support and information we're able to provide. And then we'll be working with folks as this evolves over coming weeks and months, as we all learn more and know the value of bringing people back together, but also know what needs to be balanced in terms of safety for the participants as well as the staff. And I also just want to say HICAP guidance. I saw you, Tatiana, in your comment. That'll be coming next. We're kind of doing one at a time as quickly as we can, and HICAP will be early May. So thank you for surfacing that as well.
Thank you, Kim. And before we turn to closing comments, I just want to remind folks that if we didn't get to your question, or you think of questions right when you log off, which so frequently happens to me, you can email your comments or questions to communications@aging.ca.gov. That email's right there on the slide. And with that, I'll turn it over for closing comments.
Mine is one simply of gratitude to all of you. Thank you. There's great suggestions in here. I saw, Eileen, thank you for the suggestion around hesitancy. That's absolutely where our outreach campaign that we are thinking about is addressing questions, concerns, making access easy, and helping us get to over 90% of older adults, as well as families and caregivers vaccinated as well. So thank you so much. Lots of follow-up to come on everything from reopening to partnerships. And please give us your feedback both on the format and the content, and look for the deck to be posted soon. So thank you for joining us.